There are many types of brain diseases, ranging from injuries and infections to brain tumors and dementia. They can impact your ability to function and carry out daily activities. Outcomes vary widely depending on the type of brain disease, location and severity of the condition. Symptoms and causes, diagnosis and tests, management and treatment, prevention, outlook/prognosis, living with. Overview. What are brain diseases? Your brain is the control center of your body. It regulates growth, development and bodily functions. All of your thoughts, feelings and actions begin there. Your brain is part of your nervous system. A network of nerves carries signals to your spinal cord and brain from your body and the outside world. Your brain processes the signals and sends responses back out through your spinal cord and nerves. A wide range of diseases and disorders affect your brain. They can alter a person's behavior, personality, and their ability to process information and function. Many brain diseases impact a person's capacity to carry out daily activities. What are the types of brain diseases? There are many types, including hundreds, of rare brain diseases. The general categories of brain diseases include autoimmune brain diseases. Autoimmune brain diseases occur when your body's defenses attack a part of your brain, mistaking it for an invader. Multiple sclerosis, MS, is the most prominent of these. Like electrical wires, nerve cells have insulation covering them. Multiple sclerosis attacks this in your brain, spinal cord, and the nerves going to your eyes. There are less common autoimmune brain diseases that mimic MS. There are others, like autoimmune encephalitis, which irritate your brain, causing confusion and involuntary movements. Epilepsy. Epilepsy is a tendency to have seizures. A seizure is an electrical storm in your brain, typically interfering with consciousness and causing convulsions, uncontrolled movements. Some seizures can be subtle, only causing clouding of consciousness or uncontrolled movements of one part of your body. Infections. Infections occur when various types of germs invade your brain or its protective coverings. Meningitis happens when your protective coverings are infected. It often causes headaches, confusion, and a very stiff neck. Sometimes, it's necessary to do a spinal tap to find out which germ is causing an infection so the right antibiotics can be given. Mental illness. Mental, behavioral, and emotional disorders can diminish a person's quality of life and ability to function. Major types include anxiety, bipolar disorder, depression, post-traumatic stress disorder, PTSD, schizophrenia. Psychiatrists and psychologists generally treat mental illnesses. If your brain were a computer, and in some ways, it is, your mind would be like a program running in it. In other words, your mind is your brain's operating system. Psychiatrists and psychologists are like computer programmers who try to figure out why this program is causing distress instead of working as it should. Often, treatment involves both medications and therapy. People are sometimes hesitant to see a mental health specialist. But they shouldn't be. Mental illness affects 1 in 5 adults. Neurodegenerative brain diseases. Neurodegenerative disorders are often due to the accumulation of abnormal proteins in your brain. They include Alzheimer's disease, Parkinson's disease, and ALS, amyotrophic lateral sclerosis, among many others. They're most often slowly progressive and interfere with thought, memory, movement, or some combination of these things. They're more common in the elderly. Some run in families. Neurodevelopmental disorders. Neurodevelopmental disorders affect the growth and development of your brain, and are usually cared for by pediatric neurologists. Medical geneticists may determine whether a disorder is likely to be inherited. If it is, they provide family counseling. There are a large number of neurodevelopmental disorders, including attention deficit hyperactivity disorder, ADHD, autism spectrum disorder, dyslexia, stroke. Strokes occur when a blood vessel supplying your brain with the nutrients it needs gets blocked or, less often, bursts. Either way, the effects are sudden. Stroke damages part of your brain. This can lead to problems with speech, understanding, vision, strength, sensation, or coordination. If enough of your brain is damaged by one or more strokes, it can cause dementia. Occasionally, seizures occur due to strokes. Traumatic brain injuries. Traumatic brain injuries include concussions and more serious brain injuries such as gunshot wounds. Brain injury may happen due to falls, auto accidents, sports injuries, or domestic violence, including child abuse. Repeated head trauma can cause brain scarring, leading to chronic traumatic encephalopathy, CTE. Neurosurgeons may care for penetrating injuries and bleeding. Psychologists, psychiatrists, and speech therapists may be consulted for behavioral and thinking problems after brain injuries. Neurologists often care for the injured as well. Tumors. Brain tumors can develop when cancer spreads from other parts of your body, such as your lung, breast, or colon. Or they can form in your brain tissue itself or its coverings. Unlike tumors spreading from other places in your body, tumors arising in your brain itself or brain coverings are considered benign if they grow slowly and don't invade surrounding brain tissue. They're considered malignant if they grow rapidly and invade surrounding brain tissue. Astrocytoma is a common tumor arising from your brain itself. Meningioma is a common tumor arising from the coverings of your brain. How common are brain diseases? Brain diseases affect many people, but the occurrence of individual diseases varies widely. For example, in the U.S., Alzheimer's disease affects more than 6 million people. Autism spectrum disorder occurs in about 1 in 44 children. Brain tumors and other nervous system cancers are relatively rare, accounting for 1.3% of all cancers. Epilepsy impacts 1.2% of the population, including 3 million adults and 470,000 children. Meningitis is rare due to widespread use of the meningitis vaccine. In 2019, only 371 cases were reported. Mental illness is very common, affecting 1 in 5 adults. Multiple sclerosis is a condition nearly 1 million people are living with. Strokes occur in nearly 800,000 people each year. Traumatic brain injuries caused over 220,000 hospitalizations in 2018. Symptoms and causes. What causes brain diseases? Some common causes and risk factors of brain disease are environmental toxins and radiation. Long-term exposure to toxic chemicals and radiation may increase the risk of some brain diseases, such as brain tumors. Genetics. Certain genes and genetic mutations can cause or increase the risk of many brain diseases. Researchers have identified genes or specific mutations involved in brain tumors, epilepsy, neurodegenerative disorders, neurodevelopmental disorders, and mental illnesses. Disease-causing genes may run in families or occur spontaneously. Immune system function. Autoimmune brain diseases happen when your immune system attacks other cells in your body. Infections, bacteria, viruses, and other organisms cause brain diseases such as meningitis. Injuries, accidents and injuries cause most traumatic brain injuries. An injury to your brain can also increase your risk for other brain diseases, such as epilepsy and Alzheimer's disease. Unhealthy lifestyle choices, poor diet, lack of exercise, smoking, and alcohol use are linked to stroke and Alzheimer's disease. Healthcare providers aren't sure why some types of brain diseases happen. For example, about 60% of epilepsy cases have no known cause, idiopathic. Researchers are actively investigating diseases of the brain to better understand their causes and how to treat them. What are the symptoms of brain disease? Your brain controls all of your bodily functions. If your brain is injured or diseased, any of those functions can be impacted depending on the type, location, and severity of the condition. You may experience general symptoms, such as fever, headaches, nausea and vomiting, seizures, unconsciousness. Brain diseases may also show up as changes in balance, behavior, breathing, coordination, focus, memory, mood, movement, personality, physical sensations, speech, strength, swallowing, vision. When in doubt, contact your healthcare provider. How are brain diseases diagnosed? The most important step in diagnosis is the history and physical exam. During the physical exam, the emphasis is on the neurologic exam. It includes motor, sensory, reflex and thinking tests. The findings of this examination direct what other tests may be needed. Other testing may include biopsy. Your healthcare provider collects a small sample of tissue for laboratory analysis. Biopsies help determine whether a brain tumor is cancerous or non-cancerous. Diagnostic testing. These can include an electroencephalogram, EEG, to measure your brain's electrical activity. Evoked potentials testing assesses the transmission of nerve signals to your brain. Imaging tests, CT, MRI and PET scans provide detailed images of your brain. They can detect brain activity and areas of disease or damage. Laboratory tests, blood, urine, stool or spinal fluid testing can help your healthcare provider understand what might be causing your symptoms. Genetic testing can identify gene mutations known to cause some brain diseases. Mental function tests. You complete these tests on paper or on a computer. These allow your healthcare provider to evaluate your memory, thinking, and problem-solving abilities. Neurological exam. Your healthcare provider will check for changes in your balance, coordination, hearing, eye movement, speech, and reflexes. Management and treatment. How are brain diseases treated? Beyond prevention, treatment varies with the kind of disorder. Some disorders can be cured, for example, taking an antibiotic for meningitis or removing a tumor. Others can be treated, but not cured, such as taking medications to control the symptoms of Parkinson's disease or to prevent seizures. Others must be accommodated to, such as using a cane or walker to cope with some balance disorders. Treatments your healthcare provider may use include counseling and cognitive behavior therapy to manage mental health concerns and provide emotional support. Diet, exercise, and stress management to improve symptoms of some conditions such as Alzheimer's and multiple sclerosis, and prevent recurrence of stroke. Medications to treat the disease and manage symptoms. Minimally invasive endovascular surgery to repair a burst blood vessel. Physical, occupational, or speech therapy to regain lost abilities. Rest to help your brain heal. Surgery to stop internal bleeding, remove a brain tumor, or prevent epileptic seizures. Prevention. How can I prevent brain diseases? An ounce of prevention is worth a pound of cure. A healthy diet and activity, along with controlling medical illnesses, such as high blood pressure, diabetes, and high cholesterol, and making sure you're vaccinated against infections of the brain and nervous system can avoid preventable brain illness. Here are some general guidelines that may reduce your risk for preventable brain diseases. Adopting a healthy lifestyle. This includes a heart-healthy diet, regular exercise, quitting smoking, limiting alcohol consumption and reducing stress. Avoiding excessive exposure to X-rays and other sources of radiation. Ensuring you and your loved ones are vaccinated against bacterial meningitis. Knowing the warning signs of a stroke and seeking immediate emergency medical care. Managing chronic health conditions, such as high blood pressure, high cholesterol, diabetes, and obesity. Reducing your risk of head trauma by preventing falls, wearing your seatbelt and wearing a helmet when cycling or playing contact sports. Staying mentally and socially active. Outlook/prognosis. What is the prognosis for people with brain disease? Some brain diseases will heal without permanent damage. Others may resolve but leave deficiencies in your mental or physical abilities. Some are lifelong, progressive conditions. Your healthcare provider will work with you to manage your symptoms and help you preserve or regain as much function as possible. Living with. When should I contact my healthcare provider? Early treatment for brain injuries and diseases is essential. Have your healthcare provider check out any head injuries, even minor ones. Also, notify your healthcare provider if you experience any unusual changes in your behavior, mood, or personality. Memory and ability to focus. Physical function, including movement, balance, and coordination. Speech. Vision. Call 911 if you have any warning signs of a stroke. These are usually painless and cause sudden changes such as altered speech, slurring or confusion, or difficulty understanding others. Difficulty seeing in one or both eyes. Headache. Loss of balance, coordination, or ability to walk. Weakness or numbness in your face, arm or leg, especially on one side. A note from Cleveland Clinic. There are many types of brain diseases. Some are quite common, while others occur in only a few hundred people each year. Your healthcare provider will evaluate you closely to determine what's causing your symptoms and provide an individualized treatment plan. If you or a family member have experienced a brain injury or disease, follow your healthcare provider's instructions for treatment and long-term management. Therapy, medications, lifestyle changes, and proper support can help you live the fullest life possible. Hot and cold. Good and bad. Light and dark. We're surrounded by binary forces that are seemingly in opposition with each other. When you start to look at them a little closer, you begin to realize that many of these things work together in tandem. And when it comes to thinking of ourselves as complete individuals, there's certainly more to our identities than meets the eye. In fact, many of us may have a dark side, a so-called shadow self, that we like to keep hidden despite it being a big part of who we are. Registered psychotherapist Natasha Duke, M.A., R.P., explains why the shadow self is not necessarily as terrible as it sounds and how shadow work can help you embrace your dark side features. What is shadow work? Shadow work and the idea of a shadow self carries a lot of negative connotations. Some of us might conjure up images of Peter Pan's shadow, the rambunctious, primitive opposite of our storybook hero, who always makes matters worse. Others might think of a haunting shadow instead, the kind that lurks just around the bend, or a dark side that calls to our more sinister nature. But in truth, shadow work and the shadow self aren't as scary as they appear. In fact, they provide a great deal of enlightenment when it comes to how we identify and regulate our emotions and how we perceive ourselves and the world around us. Shadow work and the shadow self are terms derived by the Swiss founder of analytical psychology Carl Jung. The idea of shadow work is that we all have parts of ourselves that we've repressed or largely ignored. Those long-forgotten aspects of our personalities, the parts of our identity that we've come to reject, make up our shadow self. The parts we hide from ourselves are not inherently good or bad, says Duke. They're just a part of who we are. And though we may reject these aspects of our identity, they still reside in our unconscious mind as a part of our core sense of self. It's up to us, then, to explore and uncover those parts we've repressed over time. By doing shadow work, we can find ways to accept those long-hidden parts of ourselves and integrate those aspects of our shadow self into our overall identity in the effort to become a whole person. We often refer to shadow work as working on our blind spots, notes Duke. Often, the shadow self is created in childhood when we're told that something about ourselves is bad or that there's a part of ourselves that is not okay or unlovable. If you grew up a very talkative child, your parents might have told you repeatedly to be quiet or talk less often in social settings. In order to feel loved and accepted, you might have started to repress that talkative aspect of your personality. And over time, as you continued to repress those parts, your shadow held onto those feelings until they bubble over or they're triggered by external stimuli. What we resist persists, states Duke. We start to be triggered by the traits that we possess in our shadow self. And when we don't work on our blind spots, they come out in our relationships. Another example, if you view yourself as a really generous person and you value that strongly, there's a good chance that within your shadow self, you might have repressed feelings of selfishness. What's going to happen is that every time you encounter someone who is putting themselves first, you might be triggered and those feelings will bubble up for you, says Duke. This person might not be doing anything right or wrong, maybe they're just putting themselves first, making themselves a priority, or they're not always available to other people and they have boundaries. But if you haven't integrated that part of you that you consider selfish into your personality, you're going to be triggered by that and you're going to have conflict with this person when they show this side of themselves. At its core, shadow work is about discovering what sets you off and identifying the underlying causes for why they trigger such strong emotional reactions. It's also about self-acceptance and coming to terms with the parts of your identity that carry any sort of unnecessary and unhelpful shame or guilt. It's good to be able to see the beauty in all parts of yourself, says Duke. It's not that the shadow self is holding bad things at all. It's that the shadow self could unlock new and exciting aspects of your personality that you've actively been avoiding. Who is shadow work for and who should avoid it? Everyone can benefit from shadow work because we're all going to benefit from being more self-aware and self-actualized, says Duke. But we need to look at how we're going to do it. Because shadow work can unearth potentially uncomfortable and complex emotions related to the things you've repressed, it's not advised to do shadow work on your own. In many cases, all types of therapy lend themselves to shadow work in some way. Psychoanalytic therapists especially have training in shadow work to dive a little deeper. It can be difficult to unlock what we've been repressing and uncover that without an objective party, says Duke. Often, shadow work is a long-term therapy. So, you want to ensure you have the time and the finances to dedicate to this, and that you're in a space with your mental wellness to be able to confront some of the things that might come up in therapy. Not all shadow work is trauma-related, but if you've experienced trauma, shadow work can be particularly challenging and unsettling. You'll likely revisit some of the events surrounding your initial trauma, so preparing for that experience and having a therapist to guide you through that process is really important to your health and wellness. If you have any underlying mental health conditions like anxiety or depression that's been recently triggered or difficult to manage, you may also want to prioritize treating those conditions before diving into shadow work, as they could cause additional complications during your therapeutic journey. If you're experiencing any acute issues like panic attacks or insomnia that's affecting your everyday functioning, I would look into coping strategies for that prior to doing shadow work, advises Duke. We need to be able to regulate our emotions to a reasonable extent before we can begin to do shadow work because it could bring up quite a bit of unexpected or uncomfortable emotions that are difficult to work through in the beginning. Benefits of shadow work. There isn't much peer-reviewed research on shadow work, as it's hard to measure. Shadow work can be done in so many different ways and people are affected by shadow work differently. Being able to validate how you're feeling and see those aspects of your personality in a different light is enough for some people, notes Duke. For others, they might need more techniques or deeper work to come to terms with how they feel about themselves. There are several benefits to shadow work, including improved self-esteem and self-acceptance, feeling like a whole person and having a holistic sense of self, strengthened relationships with other people, learning healthy coping mechanisms and how to set boundaries, ability to confront regrets and stop negative self-talk. How to get started with shadow work. Before starting shadow work, it can be beneficial to keep a running tab of every time you experience a strong mental, physical, or emotional reaction to people and things happening around you. What makes you irrationally angry? What moves you to sadness? When do you feel uncomfortable but can't quite put your finger on the reasons why you're feeling anxious, afraid, lonely, or confused? Journaling your experiences is a really good start because once you begin to notice what you're dealing with, you can't unnotice it, says Duke. During your earliest visits with a therapist, you'll likely be asked to share some of these experiences and recount how events unfolded, how they made you feel and how you reacted to them. The focus in the beginning will likely be on what your goals are for shadow work. Do you want to have better relationships? Do you want to feel like a more integrated person? Do you not feel whole? Are you experiencing a lot of anxiety or low self-esteem? These are all general questions we might go over in the beginning, explains Duke. Your therapist will also likely ask thorough questions about your childhood history and what life was like as you were growing up with your primary caregivers. Understanding the family dynamics and understanding your childhood is really where understanding your shadow self begins because often there's some generational trauma that gets passed down, Duke further explains. What traits were you told to embrace? What traits were you told to avoid? What were your ideas of good and bad behavior and good and bad traits? What were you rewarded for? What were you punished for? These can all be good starting points in looking at what the shadow might be hiding. From there, your therapist will work with you in a collaborative process to identify aspects of your shadow self and come up with techniques to help you accept, process, and embrace those parts of your personality in your day-to-day life. We uncover these things together because they're blind spots, says Duke. You're not always going to recognize these blind spots and you may not even accept them at first. But after a few therapy sessions, months down the line, you might start to recognize parts of yourself you want to touch on. Depending on your therapist, you might also participate in other activities as part of your therapy to help this process along. In some cases, people will do a chair or mirror exercise, where you project your shadow self across from you and have a conversation with your shadow self to confront your feelings. Art therapy and psychodrama can also be a part of your ongoing treatment. As you're going through this process, you'll also want to make sure you set aside time for self-care and positive self-soothing activities that keep you grounded and feeling safe and supported. Remember, you're not alone in this journey of self-discovery, and every part of who you are is just as important as the parts you've always loved before. Often, with shadow work, you might feel worse before you feel better, says Duke. Grounding techniques will put you back to the here and now, and that can include meditation or exercise, all things that are important to your physical, mental, and emotional health. Do you take on the stress of others? Are you very sensitive? Do you feel overwhelmed in crowded spaces? If you answered yes to any of these questions, you may be an empath. An empath takes on the feelings of others and can relate to what someone else may be feeling, whether that's emotionally or physically. And while being an empath can mean you're a caring, thoughtful person, it can also be overwhelming and leave you with little or no time for yourself. Psychologist Shavana Childs, PhD, shares signs that you may be an empath and if you're not, how you can be more empathic toward others. What is an empath? What does it mean to be an empath? If you're looking for an empath definition, Dr. Childs explains it as this: an empath is a person who has the ability to feel what others are feeling and understand what others are feeling. They're also known to feel feelings on a deeper level and take on the feelings of others. For example, an empath may turn the channel on TV to avoid seeing a character get embarrassed. Or if you have a friend who's sick, you may start to also feel some of their symptoms like a headache or cough. And while being an empath isn't considered a medical condition or disorder, there's some science behind it. While we can't say for sure if empaths truly exist, research shows that we do have what scientists call mirror neurons, which allows us to mirror others' emotions, and we believe those who are empaths have more mirror neurons, explains Dr. Childs. So, is there a difference between how we sympathize versus empathize? Yes, says Dr. Childs. When we exhibit empathy, we're able to understand how someone else feels and can relate to their situation. When we have sympathy, we tend to feel pity and are relieved that we don't have the same problems. Types of empaths. There are different kinds of empaths. A few common ones are emotional empath. With this type of empath, you're sensitive to the emotions of others, feeling happiness when someone else is happy or feeling anger when someone else is angry. Physical empath. This type of empath is tuned into others' physical pain. In some cases, a physical empath may even experience symptoms that aren't their own. Intuitive empath. A unique kind of empath, intuitive empaths are exceptionally perceptive and may even have psychic ability. And you might have heard of the term dark empath, which means that you use your ability to understand others' feelings for your own personal gain. Sometimes, being an empath and narcissist can go hand in hand. A dark empath can be a dangerous person because they know exactly what they're doing, explains Dr. Childs. They have elevated levels of empathy, which allows them to be manipulative. Instead of using their powers of empathy for good, they're using them for malicious purposes. Protect yourself by setting good boundaries, indulging in self-care, leaving the situation or person and seeking therapy, if needed. Signs you might be an empath. While you can take an empath test online, there are some basic signs you might be an empath, no test required. Dr. Childs says if you're an empath you may have these empath traits. You have empathy. You're able to understand someone else's feelings and people tend to tell you their problems. An empath can show empathy in several ways. However, at the core is them helping in whatever way they can to alleviate another person's pain, notes Dr. Childs. This could be listening, holding their hands, donating to a cause or just being in silence with someone as they sit in their emotions. You have good intuition. You tend to trust your instinct and go with your gut when it comes to making decisions. This is also helpful when it comes to trusting people. You tend to pick up on subtle cues that help you determine if someone is being untruthful. We have all that time when we wanted to trust our gut. Empaths have this on a higher level, says Dr. Childs. This can alert them to stay away from negative energy, people, places, or situations, thereby lowering stress levels. You're caring. You also tend to be unselfish. You take great strides to make sure others are happy, as you're often tuned into what others need, she says. Others may see you as a kind, warm-hearted person whom they can turn to for advice or help. On the downside, it may be hard for you to set boundaries, as you're always concerned with how others are feeling and what you can do to help. You're sensitive. You have high sensitivity and not only to emotions or how others feel. Some people are sensitive to sights, sounds, smells and textures, and those can be triggers for empaths, notes Dr. Childs. For example, those diagnosed with misophonia have difficulty with certain sounds. This can mean that you often feel overwhelmed in crowded spaces and often need to take time to recharge after social situations. Pros and cons of being an empath. As with most things in life, there's an upside and a downside to being an empath. Dr. Childs explains. Pros. You're considered a good listener and can determine when someone is being dishonest or deceitful. And by understanding others on a deeper level, you can improve someone's mood when they're sad, upset, scared or overwhelmed. If you're attuned to how others feel, you're also in a position to help them feel better, says Dr. Childs. You're genuinely a person who cares for others and is attentive to the needs of others. You don't suffer fools or liars, you can spot them. Cons. Being an empath can take a mental toll and increase your risk of burnout. Being an empath can become overwhelming if you're continually giving of yourself and not providing the same care for yourself, she continues. Self-care is imperative and even more so for an empath. Compassion fatigue can become a serious issue where you take on other emotions that it begins to impact your mental health in a negative way. We all need an outlet. Remember to replenish your cup before pouring into someone else's. You may also tend to avoid conflict or be easily hurt by what someone says to you. This can be because not only do you have your own feelings, but you also tend to take on the feelings of the other person. How to protect yourself. As mentioned, it can be overwhelming and draining to be an empath. So, how do you protect yourself? Dr. Childs suggests the following. Make time for yourself. Self-care is important. While you tend to spend time taking care or supporting others, make sure you also focus on your own mental well-being. Take the time to reset and recharge. There are many ways to engage in self-care. For example, take a walk outside, practice yoga, or curl up with a good book. Spend time with people who can pour into you as well. You may have a relationship, or two, that seems one-sided. All you do is talk about that person's problems and life. So, be aware of those toxic relationships and work on setting boundaries. And Dr. Childs says it's important that you surround yourself with others who take the time to ask how you're doing and who you know you can turn to for advice and support. Find a good therapist to help balance yourself if having difficulty with this. Therapy can teach you tools to manage your own emotions and how not to carry the emotions of others. How to be more empathetic. If you don't identify as an empath, there are ways you can weave more empathy into your everyday life. Here are some things you can do. Be more open. Taking the time to be vulnerable with others about your feelings can help them feel more comfortable sharing with you. Practice active listening. Consider what they're saying, how they're saying it, and look at their body language. This can give you clues to how they're truly feeling. Picture yourself in their position. Imagining how you'd feel or act in someone else's shoes can help you have more empathy. You'll be more likely to understanding and show compassion. Final thoughts. If you consider yourself an empath, there are highs and lows to being more attuned to how others feel. If you can establish boundaries in your relationships and take time for self-care, you'll be able to use your empathic traits in a positive way to help others work through their problems, and you'll be seen as a trusted, caring person. The feeling of connectedness, shared experience, and being in tune with another person can be a beautiful thing in moderation, says Dr. Childs. Being an empath is good if you can establish boundaries on the amount of energy you give to others, making sure to reserve energy for yourself. Make sure you take the time you need for self-care and that you replenish your energy. Dogs and cats are warm, cuddly, and oh so lovable. They make hearts melt with every little tail wag or purr. These household pets are so much more than animals. They're members of the family. But when it comes to finding a place to sleep, well, maybe it's best to give our furry friends a little space. In general, sleeping with a pet isn't recommended if you're looking for a solid night of ZZZs. Of course, that doesn't stop people from doing it. Online polls show that more than half of pet owners share a bed with their pets. There are pros and cons to that sort of nighty-night setup. Let's take a closer look with sleep medicine specialist Nancy Foldberry Schaefer, DO, MS. Reasons not to sleep with your pet. Living with a pet can offer numerous health benefits, but that doesn't mean everything about sharing your home with an animal is hunky-dory. There's an awful lot of butt scooting on the carpet, for instance. When it comes to letting a pet spend the night in your bed, here are 5 concerns. Sleep disturbances. Sharing a bed leads to a shared sleeping experience. So, if your dog wiggles around at night while dreaming of chasing squirrels, that nocturnal activity may be just enough to interrupt your own dreams. Many people wake up repeatedly during the night because a pet is repositioning or barking or needs to be taken outside, notes Dr. Foldberry Schaefer. It can be a big component of sleep disruption. Someone who wakes up in the middle of the night may end up staying up, too, and few people can afford to lose those precious minutes, or hours, of rest. Research shows that 1 in 3 adults in the United States doesn't get enough sleep. Don't minimize what that loss of sleep means either. Over time, it can be a big deal. Consistently falling short of ZZZs can increase your risk of developing conditions like type 2 diabetes, heart disease, dementia, depression, obesity, allergies, and asthma. Studies show a strong connection between sleep troubles and allergies. Ditto if you have asthma. Adding a pet to the bed can escalate those breathing issues. Sleeping with a furry friend exposes you to allergy and asthma triggers, such as pet dander, for multiple hours in close quarters. There's a real chance your allergies or asthma can be activated, says Dr. Foldberry Schaefer. Creepy crawlies. Fleas and ticks have been known to hitch rides and hang around on dogs and cats. If those parasites are on your pet when they jump into your bed at night, they very well might end up on you by morning. Flea bites can leave you with itchy and irritated skin that can be very annoying. In a worst-case scenario, the bite of a disease-infected tick could make you seriously ill. Tick bites can cause diseases such as Lyme disease, Rocky Mountain spotted fever, ehrlichiosis, alpha-gal syndrome. Diseases. Not to gross you out, but animals can potentially spread a lot of germs. Aside from the conditions listed above, there are about 100 other zoonotic diseases, including cat scratch fever, that can spread from animals to people. The U.S. Centers for Disease Control and Prevention, CDC, offers details on all these diseases. To be fair, not all conditions on the CDC list involve household pets. But a good number do. Bottom line? There's certainly potential exposure to germs when we have pets in the bed, says Dr. Foldberry Schaefer. Bite and scratch potential. Dogs and cats often don't take kindly to being disturbed during a slumber. Their instinctive startle reflex may include using their claws or sharp teeth to send a message to the sleepy time offender. Any bite or scratch brings a risk of infection. Here's what to do after being bitten by a dog. And if you tangle with a cat, here are some treatment tips. Reasons to sleep with your pet. Many of the reasons why we adore our pets serve as the very reason why we make room for them in bed. The list includes happiness. There's a reason why we often feel better after hanging around with a pet. A little one-on-one time with an animal friend can decrease stress-related hormones and boost your mood, reports the National Institutes of Health. A lot of people are just happier being around their pet, and that includes when they go to bed, notes Dr. Foldberry Schaefer. A feeling of security. Pets can alert you when something isn't quite right in your home. In some cases, pets can even offer comfort and protection. People often feel more secure in their environment with a pet around, she adds. Warmth. Those fuzzy coats on our pet friends can come in handy while cuddling on a cold night. It's also worth noting that dogs and cats run a few degrees hotter than humans. Tips for sleeping with your pet. So, if you're leaning toward spooning your dog or cat while you sleep, these 6 tips from Dr. Foldberry Schaefer may help you sleep a little better. Use an air filter. Want to minimize allergy and asthma issues? A high-efficiency particulate air (HEPA) filter can help remove more than 99% of pet dander and other allergy and asthma triggers swirling around your bedroom. Wash your sheets more often. Pet dander and fungal organisms can come with dogs, cats, and other furry friends. Tossing your bedding in the washing machine more regularly, target once a week, can keep that icky stuff from accumulating. Pet bath time. A clean pet is less likely to bring germs, fleas, and ticks to your bed. Get them in the tub. Define sleep space. Keeping your pet in bed with you doesn't mean they have to be right up against you. Consider setting them up in a different part of the bed so they're close, but maybe not too close. A bigger bed may be worth considering, too. Plan ahead for disruptions. If your pet often wants a late-night snack or regularly answers nature's call at 2 a.m., build that into your sleep routine. Going to bed a little earlier may allow you to get up with them and still get enough hours of sleep. Be consistent. Set limits and boundaries and then stick to them. Consistency can lead to standard practices that your pet learns to adhere to and that may allow everyone to sleep better, advises Dr. Foldberry Schaefer. At the end of the day, snuggling your pet in bed at night could lead to problems getting a restful night of sleep. Or you may curl up next to your dog and cat under the covers and never miss a wink. So, which way is right? There's one surefire way to decide. If your sleeping with your pet is affecting your sleep quality and you're waking up tired every morning, life changes during the transition between adolescence and adulthood may reveal something unexpected: early signs of schizophrenia. The onset of the mental health condition typically begins in a person's 20s. Schizophrenia tends to appear earlier in men and people assigned male at birth, AMAB, beginning in their late teens to early 20s. Women and people assigned female at birth, AFAB, usually see it start in their mid-20s to early 30s. But the disorder can begin at any age. Symptoms often show themselves slowly and worsen over a period of months or years, says psychiatrist Minnie Bowers-Smith, MD. Here's what to look for. Warning signs of schizophrenia. Schizophrenia changes the way that you think, behave, and relate to others. People with schizophrenia don't seem to interact with the world in a healthy way, explains Dr. Bowers-Smith. There's a loss of touch with reality. Signs of the mental illness can be subtle in the initial, or prodrome, stage and easily attributed to other life changes or activities. Common early symptoms include emotional changes. Mood swings can become more frequent as someone enters the early stages of schizophrenia. They may seem more irritable or angry. Fears of the surrounding world may grow. Suspicions may turn into paranoia. Disconnecting. Time spent with friends and family may suddenly dwindle. Phone calls stop. Conversations are avoided. You tend to isolate yourself and seem preoccupied with your own world, says Dr. Bowers-Smith. Lack of focus. Schoolwork, jobs, and household responsibilities can begin to get neglected as thoughts wander further from reality. Irrational excuses may be offered to explain overlooked tasks or missed appointments. Motivation disappears. Early and active signs of schizophrenia. The first signs of schizophrenia may last as little as a few weeks or as long as a few years. The active stage of the mental illness that follows brings more noticeable symptoms, notes Dr. Bowers-Smith. These can include hallucinations or hearing voices, delusional beliefs, incoherent speaking, unusual physical movements ranging from catatonic behavior to excessive motion, negative symptoms such as speaking in a flat tone, lack of eye contact and rigid body language, living in denial. Even as schizophrenia sets in, many people will overlook or explain away early signs of the condition. Denial can become a coping mechanism even as you see a loved one not functioning well. In many cases, a college may be the first to send a young adult to be evaluated because of erratic behavior or a drug overdose. Families often don't seek help on their own, notes Dr. Bowers-Smith. It's natural to struggle to understand schizophrenia symptoms or ignore the signs until they escalate, sometimes into violent behavior. But without help, problems will continue, especially when fueled by drugs or alcohol. If you find them up all hours of the night, or painting their room black, or too irritable or scaring people, call the doctor, stresses Dr. Bowers-Smith. When to seek treatment. The earlier the better when it comes to seeking treatment for schizophrenia once symptoms appear, says Dr. Bowers-Smith. Healthcare providers diagnose the illness based on questioning and observations. A diagnosis of schizophrenia is life-changing for those affected and everyone who loves them. It's a step toward treatment and a full life. People with schizophrenia can finish college, work jobs, get married and have families. There isn't a cure for schizophrenia, but the condition can often be managed through a combination of medication, supportive therapy and education for the person and their family members. If you can manage the symptoms, you can have a reasonably stable life, reassures Dr. Bowers-Smith. That's why it's key to engage people early on and encourage them to find a doctor they can relate to and a therapist who understands them. Research indicates that the earlier the treatment, the better the outcome. The National Alliance on Mental Illness, NAMI, offers support groups for the mentally ill and their families. Other support groups are Students with Psychosis, ideal for students. Supportive, focused on peer-to-peer support. NAMI Connection Recovery Support Group offers regular meetings. Schizophrenia Alliance, good for making local connections or for finding online support and discussions. There are many mental health providers who can provide help. They're trained to eradicate the stigma associated with mental health in general and schizophrenia in particular. Know this, too, if you're dealing with schizophrenia in your life, you're not alone. The condition affects about 0.5% to 1%, or 24 million people worldwide, according to the World Health Organization, WHO. I really blew that work presentation. I hate how I look in this dress. I'm so mad that I ate that pint of ice cream. I'm so stupid. Why did I say that? If this were a friend or a family member venting to you, you'd offer empathy, compassion and understanding. But many times, when these negative thoughts are in our own heads and directed at ourselves, we struggle to give ourselves the same kindness we extend to others. Instead of being tough on ourselves, we could all do a better job of practicing self-compassion. Self-compassion is the idea of being as kind and caring to yourself as you would be to others. Registered psychotherapist Natasha Duke, M.A., R.P., explains the concept behind self-compassion and offers techniques on how to practice self-compassion. What is self-compassion? Self-compassion is about treating yourself the way you treat your close friends, explains Duke. It's really about being kind and gentle with yourself and directing compassion inward. So, how is this different from self-esteem? They're closely related. When it comes to self-esteem, research shows that it often ebbs and flows and isn't a consistent construct. Part of the reason that happens is because self-esteem is often based on comparison. Somebody might feel better about themselves in one area compared to other people, Duke further explains. With self-compassion, what research shows is that when someone begins to cultivate self-compassion and starts to practice using that muscle, it's a more consistent construct over time. It's not based on comparing yourself to anybody else. The concept of self-compassion isn't without criticism or misconceptions. Some people view it as self-pity or a way to feel sorry for yourself. This comes up a lot when I introduced the idea of self-compassion to people, and it couldn't be further from the truth, states Duke. Self-compassion isn't about having blinders. It's about being able to understand that falling down, having difficulty and experiencing suffering is all part of humanity. It's about meeting those feelings with kindness, gentleness and love and really accepting them. That doesn't mean self-compassion can't help you change and lets you wallow in your feelings of self-doubt. In fact, self-compassion is about opening up space for change, clarifies Duke. It's this dichotomy of being able to accept your situation, meet yourself with kindness, and then create space for learning from the situation without harsh criticism. That means being able to forgive ourselves, accept our flaws, and show ourselves kindness. Easy, right? Why is self-compassion important? About 20 years ago, psychologist Kristin Neff began to research the idea of self-compassion. What she found is that one of the greatest ways that we can build resiliency and actually improve our mental well-being is through self-compassion, says Duke. So, instead of meeting setbacks with our internal critic, by starting to cultivate compassion, we can actually bounce back faster, we can suffer less depression, less anxiety, less rumination, and it can even help us to meet our goals and increase our motivation for a wide range of goals. So, self-compassion can be a useful tool in reaching our goals, even if we fail a few times along the way. There are 3 components of self-compassion. Mindfulness. If we're not present with ourselves and we can't understand what's going on with us, we can't make space for our feelings, notes Duke. And if we can't do that, it's impossible to be self-compassionate because we don't even know where we're at. And if we don't know where we're at, we don't know what we need. And so this idea of your mind and body being in the same place is an important part to shore a prerequisite, if you will, for self-compassion. Self-kindness. This focuses on how you talk to yourself. We all have an inner critic. When we fall down or when we don't meet our goals, we often respond with our inner critic, says Duke. How we respond to other people versus how we respond to ourselves is often quite different. The idea of self-kindness is about trying to extend that same kindness and that same sort of more positive self-talk to yourself. Common humanity. Common humanity is about realizing and accepting that it's impossible not to have difficult periods in our lives, no matter who you are. This is part of being human. None of us are perfect and these things happen to everyone, says Duke. While the context may be different, there's suffering and pain that happens to everyone at different times in their lives. That's a really important piece because it creates that sense of connectivity versus isolation. 4 techniques for practicing self-compassion. There are different ways we can cultivate self-compassion. Duke offers the following self-compassion exercises. Write a letter to yourself. It may sound silly, but Duke says to write a letter to yourself from the perspective of your closest friend and what you imagine they'd say to you. This helps you practice compassionate dialogue, says Duke. At first, it may be tough to do. You're probably not used to talking to yourselves in that way when something doesn't go well. Here are some examples of self-compassion statements. I am good inside. I am worthy of loving kindness. I am allowed to make mistakes, I'm not perfect. The idea is that over time, you'll become familiar with speaking empathically to yourself and become more comfortable with the idea of being compassionate to yourself. Take a self-compassion break. Here's an easy technique to use when you're getting down on yourself. Start by putting your hand on your heart, instructs Duke. This has been found to release oxytocin, which is a very calming hormone. And as you're doing that, acknowledge to yourself either out loud or quietly to yourself that you're going through a really difficult time. And tell yourself that it's okay to have those difficult feelings, it's okay to be going through this difficult time, and it's okay if this is hard for you. You want to focus on breathing during this and allow space for your breathing without trying to change anything. Even 5 or 10 minutes of deep breathing has benefits. You also want to take the time to ask yourself what you need, notes Duke. What do you need to feel a little bit better right now? What do you need to get back to your equilibrium? Do you need to go for a walk? Do you need to speak to your mom? Do you need to get yourself a coffee? What do you need to even just move the pendulum a little bit? Then, when you start to feel a bit better, you can start to think about how to problem solve without criticizing yourself. You want to start to problem solve from place of love and kindness, encourages Duke. Listen to self-compassion meditation. You may or may not know about meditation. While it can come in many forms, it's a way to calm your mind and help you stay present in the moment. And there are some apps and websites that focus on self-compassion meditation. Many are a guided meditation that can last anywhere from 5 minutes to 30 minutes. This can help someone understand how to cultivate that self-compassionate muscle, says Duke. It gives an example of what a self-compassionate voice might sound like. It can help you pay attention to your inner dialogue. You'll focus on your breathing, letting your mind wander, and then repeating self-compassionate phrases like, "May I be kind to myself." Keep a self-compassion journal. As you become more comfortable with self-compassion, you may want to graduate to keeping a self-compassion journal. You want to write about any difficult situations that are happening right now, says Duke. Then, you want to ask and answer questions like, how can I be more mindful? Life is hard. And while you might be used to criticizing yourself when something goes wrong or if there's a goal you want to achieve, it may be worth giving self-compassion a try. Though that criticism might help you be successful, it's only for a small amount of time, cautions Duke. If you want long-term success and long-term emotional well-being, motivating yourself from a place of criticism is a recipe for disaster. Duke says you're more likely to procrastinate and it can create issues like resentment, anger, anxiety, depression, and insomnia. Think about it this way: a child falls off their bike. If you criticize them, they're not going to want to get back on their bike because they have this fear of failure, illustrates Duke. But if you practice compassion with them and talk about how it can be hard to ride a bike, that opens up space for them to want to try again. With self-compassion, it's almost like working with your inner child. Friendship, courtship, partnership, kinship, companionship. The word relationship has never really been enough for us, has it? We need a whole fleet of ships to understand our associations with other people. Those definitions help us create expectations, construct boundaries and set goals. But sometimes, things just sort of happen. You become romantically or sexually involved with someone without any labels or formalities. Luckily, there's a ship for that now, too. It's called a situationship. We talked to psychologist Susan Albers, PsyD, about this relatively new term. She explains what a situationship is, whether it's a healthy way to connect with another person, how to know you're in one and what to do if it ends. What is a situationship? Situationship isn't a word you'll find in the dictionary, but it's hard to avoid in popular culture. So, what is it exactly? According to Dr. Albers, a situationship is a romantic or sexual relationship that hasn't been formalized. Situationships are characterized by a lack of obligation or exclusivity, but the real hallmark is a lack of clear boundaries or labels, she explains. There are elements of friendship and romance, but they exist without defining the relationship. So, essentially, you have many of the benefits of a traditional relationship without having to make a commitment. As you can imagine, this kind of attachment has upsides and downsides. On the one hand, situationships may allow you to feel the sense of connection you'd experience in a standard issue relationship and the independence that comes with being single. On the other hand, if you're not clear on the nature of your involvement, it can't progress. And the ambiguity of situationships can take a toll on your mental health. Our brains really like clarity, Dr. Albers notes. They gravitate to black and white, so this gray area can be very hard to process and may even create anxiety. The other pitfall of a situationship: it's difficult to maintain, emotionally. Dr. Albers explains, it's very hard to stay unattached. It can feel like you're skimming the surface of a relationship. And the ambiguity can consume a lot of energy. That difficulty is a byproduct of how our brains work. We're human. And when we're intimate with someone, our brains release a hormone called oxytocin, she adds. Oxytocin is powerful stuff. It stimulates sexual arousal, ejaculation, contractions during pregnancy, parent-infant recognition and bonding, even lactation. Oxytocin also facilitates behaviors you might not expect, like trust. This stuff is no joke. And it doesn't really care if love's on your agenda or not. It's hard to override hormones like oxytocin with the logic that we're not attached to someone, Dr. Albers notes. Examples of situationships. Because they're undefined by definition, see what we did there. Situationships can vary a lot from person to person and relationship to relationship. Some situationships are healthy and some, not so much. Here are just a few examples of scenarios you might describe as situationships. That one person you meet up with whenever they happen to be in town for work. The post-breakup rebound that you've been seeing for 2 months, but can't imagine committing to, at least, not right now. The special someone you're having a passionate love affair with over spring break, and will never speak to again once school starts. That one devastatingly attractive individual you call every once a while for sex. Your go-to +1 for couple Y events, whom you'd never dream of introducing to your parents. Probably. The gaming partner from Scarsdale that you've never met in person but talk to for hours every week, and occasionally exchange racy texts with. Maybe your current, whatever it is, doesn't sound like any of these scenarios. That doesn't necessarily mean it isn't a situationship. 5 signs you're in a situationship. According to Dr. Albers, most situationships have most or all of these 5 characteristics. No labels or exclusivity. You've never had a DTR, define the relationship, conversation, and one or both of you may be seeing other people. No clear boundaries. Expectations, big and small, reasonable and unreasonable, help give our relationships definition. Are you splitting the bill? Do they get to spend the night? Is it okay to meet their kids? If neither of you are asking these kinds of questions, it's hard to know the nature of your companionship. Irregular or superficial contact. Maybe you only talk once in a blue moon. Maybe you talk several times a week but avoid intimate conversations. Maybe you had deep, soulful conversations for the 3.5 weeks you spent together in Cusco. Communication in situationships tends to be sporadic, shallow, or both. Lack of integration into each other's lives. You've never met their parents. They've never met your friends. And neither of you can find each other's houses without the aid of a smartphone. If your connection seems to exist in a vacuum, it could be a situationship. The relationship doesn't grow or end. Simply put, you aren't talking about the future or what either of you want long term. All you really know is that the relationship, whatever it is working well enough right now. Being in a situationship isn't inherently good or bad. It all comes down to the people involved and the way they interact. Situationships can be fulfilling, frustrating, or downright toxic. And like any other romantic attachments, Dr. Albers says communication and honesty are key. Situationship red flags. Situationships can be deeply rewarding when they're what you and your pseudo-partner really want. But the ambiguous nature of these pairings can also open the door for miscommunication, dishonesty and, in some cases, even abuse. Here are 5 common red flags to be on the lookout for. One-sidedness. A situationship can become toxic if you have different expectations for the relationship, or if the power dynamic between the participants is unequal. Dr. Albers cautions. Here's a good question to ask yourself: if your situationship ended tomorrow, how would you feel? Do you think they'd feel the same way? Feeling undervalued. Do you feel like you're being used for sex? Does it seem like they only call you when their other plans fall through, or they have nothing better to do? Are you starting to wonder if they even like you as a person? If you feel like the other person doesn't show you much care, it can be a sign your situationship is spiraling into abuse, Dr. Albers says. Dishonesty. You've never been to their house. They got upset when you tagged them on your social media page. They insist on driving everywhere separately. If you feel like your situationship's a secret or like you're special, someone's keeping a secret from you, that's a bad sign. Fear of communication/vulnerability. It's okay to keep things light in a situationship, but it needs to actually be a choice. If your conversations remain on the surface level because you feel afraid or hesitant to tell them what you really want, that's a red flag, Dr. Albers states. Gameplaying, testing, or passive-aggressive behavior. It's not unusual for unhealthy situationships to become exploitative or manipulative. Breadcrumbing is a classic example of a toxic situationship behavior. It involves doing just enough to string a person along and keep them interested, but never following through on anything. That person who sends you a romantic text and then doesn't respond to your messages for a month? Yeah, they're breadcrumbing you. Realizing your situationship is heading in a toxic direction is a big deal. But how do you sever a connection that was never really defined to begin with? How to end a situationship? According to Dr. Albers, most situationships end via ghosting, another relationship buzzword you may or not be familiar with. Basically, the end is unclear as the beginning, Dr. Albers explains. Often, people just stop communicating. In fact, that's a big red flag, communication coming to a screeching halt. In other cases, the situationship slowly fades away, which can make an already ambiguous romance downright confusing. When a situationship ends, spookily or otherwise, the experience can be upsetting, especially if you feel a lack of closure. That's why Dr. Albers recommends being direct. It's helpful to communicate really clearly that it's over, instead of ghosting the other person, she advises. And don't hesitate to cut the cord if it's lingering. It can help you avoid the random texts and late-night phone calls that keep you from moving on. Ending a situationship often has added layers of complexity. It can be different than mourning the end of a traditional relationship because the breakup conventions might not apply, Dr. Albers further explains. For example, when a conventional relationship ends, we talk to our friends, who can relate to our situation and comfort us. When it comes to situationships, they may not even be aware of what's been happening. And even if they are, they might not be as empathetic. If you aren't getting the support you need from other people, Dr. Albers suggests turning inward. Remind yourself that situationships end for a lot of the same reasons more formal romantic partnerships end: somebody's needs aren't being met. Hanging on to a situationship that's no longer serving you can prevent you from finding a romance that will. Take the time to pause, Dr. Albers recommends. Maybe do some journaling reflecting on the pros and cons of your situationship. Think about what you learned, what you gained and what you'd want to avoid in the future. Mindset is key. Really look at the situationship as a learning experience and not a mistake or failure, she continues. Understand it instead as just one aspect of your relationship history. If situationships are becoming a pattern, most of us have experienced a situationship or 2, or 10, at some point in our lives. In fact, some argue that they're the modern form of courtship. They make sense for a lot of us and can be a lot of fun during certain chapters of our lives. But that's not true for everybody. And depending on what you're looking to get out of your romantic relationships, finding yourself in situationships over and over again might be a source of concern. Do all of your relationships seem to be situationships? How does your answer to that question make you feel? If situationships are becoming a pattern, Dr. Albers says it might be worth working through why with the help of a therapist. Situationships are often connected with having an avoidant attachment style, she explains. People with avoidant attachment styles are often reluctant to get close to others. They like being independent and may feel smothered or confined in committed relationships. If you have an anxious attachment style, the opposite is true. And you probably aren't enjoying all these ambiguous relationships. According to Dr. Albers, people with an anxious attachment style look for reassurance and clarity in their relationships. So, why would a person with an anxious attachment style end up in a situationship? The short answer: trauma. Usually trauma related to divorce, abuse, or some other situation that makes being vulnerable with other people feel threatening. Situationships can be a way of keeping a distance from other people. When you've experienced trauma, you engage in hypervigilant behavior. You're always trying to read the situation. You're extra alert because you're constantly assessing the potential threat around you. As a result, you're used to experiencing confusing or mixed signals. If you find yourself in romantic relationships that don't align with your goals or meet your needs, whether or not they qualify as situationships isn't important. What is important is that you get the support you need to build attachments that make you happy. Shades of gray. Situationships are romantic or sexual entanglements where the participants haven't established the nature of their relationship. What they look like and how healthy they are can vary widely. Situationships can be a fun and low-pressure way to explore your connection with another person, but they can also be petri dishes for abuse. Clear, honest communication is the hallmark of a successful situationship. It's also the best way to end a situationship that's no longer meeting your needs. Being a woman in the modern world is many things, but it's never easy. You're supposed to be cute but not infantile, sexy but not sleazy, conventionally attractive but never basic. Be smart, but don't show off. Be ambitious, but always put family first. Be quiet. Be obedient. Be virtuous. Be perfect. And, hey, would it kill you to smile? The cultural scripts that women are expected to follow are as unattainable as they are contradictory. For many of us who identify as female, trying to meet those expectations day in and day out can take a toll on our mental health. We talked to psychologist Susan Albers, PsyD, about this so-called good girl syndrome, what it is, how to spot it and what to do if you've got it. What is good girl syndrome? The concept of good girl syndrome didn't originate in medicine, it's a product of popular culture, a phrase you're most likely to stumble across in your social media feed. But Dr. Albers says that it can still be a useful way to think about behavioral patterns. She describes good girl syndrome as the manifestation of traits that are valued or praised in girls. It has a lot to do with how caregivers, including people outside the family, like teachers, interact with girls and how those interactions shape and mold their behavior. Think about the term good girl itself. It conjures images of quiet, compliant, pretty girls who take care of others and don't cause trouble. It's rooted in society's stereotyped expectations of how women should be and the role they should play, Dr. Albers explains. When people with good girl syndrome deviate from typical good girl behavior, they feel guilty or fear being judged. Signs you may have good girl syndrome. Good girl syndrome isn't a diagnosable mental health condition. It's more like a collection of traits that cause harm when taken to extremes. Dr. Albers says that most women will see themselves in one or more of the 6 characteristics she lists. What matters most is how severely you exhibit those traits and if they cause you to act in a way that isn't authentic to you. If the need to be a good girl is impacting your mental health or your ability to be happy in your day-to-day life and relationships, then it may be time to make an appointment with a therapist. There are the 6 traits Dr. Albers associates with good girl syndrome. Let's dive into them. 1. Perfectionism. Being all things to all people is impossible, but that doesn't stop many of us from trying. Perfectionism isn't all bad, of course. Having high expectations for yourself can give you a strong sense of self-direction and discipline. The problems come when you base your sense of self-worth on what you accomplish or, if you're dealing with good girl syndrome, on how other people perceive you. Being perfect can be a way of insulating yourself from criticism or judgment of others. Women with good girl syndrome are sensitive to the feedback of other people, Dr. Albers explains. It can become a vicious cycle. Good girl syndrome creates mental health issues, and mental health issues exacerbate good girl syndrome. 2. People-pleasing. People-pleasing is another common manifestation of good girl syndrome. According to Dr. Albers, people-pleasers are good at anticipating what other people need and get a sense of safety and worth when they meet those needs. The result is that you don't speak up even if you're mistreated or want something different. Instead, you feel forced to conform. It's never a good thing to feel like you're only valuable if you're useful to others, but it's especially negative for people with good girl syndrome. They fixate on filling needs that are big and unattainable, like being the ideal partner, the perfect parent and the best friend, and never inconveniencing anybody else with needs of their own. 3. Putting other people first. Have you ever heard of the term self-abnegation? It means sacrificing or denying who you are for another person. If you're struggling with good girl syndrome, you've probably got it down to an art. Maybe you gave up a job you love to raise your children because your significant other wasn't willing to compromise. Maybe you always agree to go to your coworker's favorite, mediocre, lunch spot, even though you'd love to try the bistro next door. Maybe you let your friends give you a makeover you didn't want and still wear all the clothes you secretly hate. Maybe you drive 3 hours round trip to check in on your parents every weekend, even though your sister still lives in their neighborhood. In one way or another, people with good girl syndrome put the needs of others above their own and struggle to assert themselves in the face of conflict. 4. Issues with body image. Girls and women often feel that they need to appear a certain way to please other people, Dr. Albers further explains. That's why eating disorders and good girl syndrome often go hand in hand. People with good girl syndrome might do other self-destructive things in the name of beauty, too. You might pursue plastic surgery to look like somebody else, spend lots of money you don't have on a stylish wardrobe, or misuse substances or medications in an attempt to alter your appearance. 5. Sexual difficulties. Sexual difficulties are another hallmark of good girl syndrome. As Dr. Albers puts it, these good girls are often seen as innocent and pure, which causes a dilemma when they do become sexual. If you're struggling with good girl syndrome, you could experience any, or a combination, of the following. Fear or guilt about having, or wanting, sex, especially if the people or sex acts you desire don't fit the conventional image of female sexuality. Difficulty understanding your own sexual needs and desires because you're always focused on your partner's pleasure. Self-consciousness about your body or anything else that prevents you from fully engaging with a sexual partner. Internal pressure to say yes to sex or sex acts that makes them uncomfortable. Difficulty recognizing or responding to relationship red flags. That struggle may extend to situations involving sexual abuse or, more broadly, intimate partner violence. 6. A history of trauma. Dr. Albers says that people who struggle with extreme forms of good girl syndrome often experience trauma in childhood. Sometimes, the behaviors associated with good girl syndrome like people-pleasing and perfectionism can be a form of hypervigilance. Hypervigilance is a state of chronic alertness and sense of danger that's associated with mental health conditions like post-traumatic stress disorder, PTSD, and anxiety. Think about it as a biological adaptation. Your nervous system becomes hypervigilant because it wants to keep you safe from the kind of harm you've already experienced. It's a reasonable way for your brain to respond to trauma, but being on alert 24/7 places tremendous stress on your body and brain. So, why is hypervigilance common in people with good girl syndrome? Let's use the example of a person raised in a physically abusive household. They may be quiet, submissive, and self-abnegating because being invisible kept them safe growing up. They may try to make everything, including themselves, look perfect to avoid conflict. They may be trained to make excuses for abusers and hide their emotions. In other words, the same behaviors that help them survive an abusive situation can also make identity formation and interpersonal relationships more difficult. How to overcome good girl syndrome. If you see yourself or somebody you care about in this list, what are you supposed to do about it? Gender roles are deeply entrenched, after all. According to Dr. Albers, getting counseling is a great first step. In therapy or in counseling, we work on exposure therapy, she says. We start in small ways, learning to voice what you're feeling and also confronting other people. Sounds scary? It can be, but it's a process. We don't dive off the deep end, Dr. Albers reassures. We put the toe in the water and try it out. For example, you and your counselor might practice telling a friend that they hurt your feelings and explore how it feels to be genuine about your feelings. But as you might expect, this isn't a situation with a quick fix. We have to give it time, Dr. Albers continues. The roots are really complex and deep. Undoing them may take a while because it's such an ingrained behavior that often people don't even see it. Identifying and validating feelings. When you have good girl syndrome, one of the key things you'll work on in therapy is identifying and validating your feelings. People who have good girl syndrome often appear happy at all times, when deep down, they may feel anger, rage and resentment, all of these negative feelings that women are taught to suppress or not to have, Dr. Albers clarifies. But the feelings are there. And they're very real. Acknowledging them and knowing that they're okay is important. Learning to set boundaries. From there, a counselor helps you act on those feelings and practice setting boundaries. For example, they may help you learn to say no to people without feeling like you're doing something wrong, even if standing up for yourself sometimes causes the people around you react negatively. Ask yourself, am I meeting my own needs in this situation, too? They may try and push you back into that box, and it may take some strength and courage to not step back in, Dr. Albers understands. But having a therapist to help you through that transition period can make things much easier. Don't pass it on. If you're the parent, you may be feeling a bit nervous after learning that upbringing is a key piece of good girl syndrome. But there's good news. There's plenty you can do right now to prevent your child from developing these tendencies or to start unlearning them if they're already there. Avoid using good and bad. Dr. Albers suggests avoiding terms like good girl, good boy and good child altogether. Be mindful of your language when interacting with your children, she encourages. Instead, comment on specific behaviors, saying things like, you put in a lot of effort. She continues, acknowledge, and then let go of, the voice in your head that's telling you something is good or bad, that it's a dichotomy. As people, we don't fit into two different boxes. There's a lot of gray area in there. And this dynamic doesn't just apply to girls. Telling any child, regardless of their gender, that they're good when they're being compliant, quiet and constantly meeting other people's needs can have long-term consequences. Listen to your gut. The other thing Dr. Albers suggests parents do? Teach kids to listen to their gut. When you don't listen to your gut, it leaves you vulnerable to being taken advantage of, or put in some very dangerous positions, Dr. Albers warns. If you're afraid of being rude, you may not listen to your gut and move away from someone who is toxic or potentially harmful. In fact, you may find yourself trying to fix them or win their affection. With kids, when you teach them to be good girls or good children, they become vulnerable to predators, she continues. Predators seek out children they believe aren't going to speak up for themselves and are compliant. Children who fear being judged as bad by their parents are more likely to keep secrets. Teaching kids to assert themselves will give them the confidence they need to trust their instincts and ask for help when they need it. Goodbye, good girl. Good girl syndrome happens when girls and women internalize cultural messages about how they should behave that are stereotypic in nature. Taken to extremes, those behaviors can harm your body, mental health and personal relationships. It's a universal truth that we can't please everyone, Dr. Albers states, and that's really hard for people pleasers. They feel like that if someone doesn't like them, that their worth or their value declines. But we can't please everyone. And once you really wrap your head around that, you can make some big steps forward. While it's not a diagnosable medical condition, good girl syndrome can be just as harmful and often requires the help of a therapist or counselor to overcome. Unlearning a lifetime of good behaviors isn't easy, but it's worth the effort, especially if you're raising children of your own. If you or a loved one has been diagnosed with or is showing signs of a mental illness like schizophrenia or schizoaffective disorder, you know the roller coaster ride well. The right diagnosis can be hard to reach. And when a diagnosis does come, you may be wondering what it even means. What is schizoaffective disorder anyway? What is schizophrenia? And what does that all mean in your life? The dividing lines between a diagnosis of schizophrenia versus schizoaffective disorder are clearly laid out in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, DSM-5-TR, the current gold standard for the diagnosis of mental illness. But as you probably already know, real life isn't always as clear-cut as a reference book. The signs and symptoms of schizophrenia and schizoaffective disorder can be hard to interpret. So, we talked with psychiatrist Travis Crew, MD, to better understand these illnesses, their similarities, their differences and, most importantly, how you can manage them to live your best life. Symptoms of schizophrenia versus schizoaffective disorder. The difference between schizophrenia and schizoaffective disorder is this: schizophrenia is a condition characterized by hallucinations, delusions, and/or disordered thinking. People with schizoaffective disorder also have those symptoms and, additionally, they have symptoms consistent with episodes of depression, mania, or both. That's a lot to take in. So, let's break it down. Schizophrenia. Schizophrenia is a kind of psychosis. That means it impacts a person's perception of reality and ability to participate in logical conversations with others. Dr. Crew explains that to be diagnosed with schizophrenia, you need to have at least one of these three main symptoms of schizophrenia and show signs of illness for 6 months or longer. Hallucinations, seeing or hearing things that aren't there. Delusions, an unshakable belief in something that isn't true. Significant disorganization of your speech. Additionally, people with schizophrenia may have other symptoms that can help a healthcare provider recognize the disorder. That may include things like making slow or unusual movements, isolating oneself, or appearing emotionless. Those symptoms may be typical of some people with schizophrenia, but they aren't definitive enough for a schizophrenia diagnosis on their own. Schizophrenia symptoms often happen in stages. That means symptoms may be more severe at times and less apparent at others. Schizoaffective disorder. Schizoaffective disorder is one of the 6 types of schizophrenia. It's a thought disorder layered with a mood disorder. That means that in addition to having at least one of the 3 major symptoms of schizophrenia above, people with schizoaffective disorder also experience extreme bouts of emotional turmoil. I describe schizoaffective disorder as having schizophrenia, but also meeting some other criteria that modify that disorder, Dr. Crew explains. People with schizoaffective disorder have symptoms of depression and mania that coincide with their symptoms of schizophrenia. In other words, people with schizophrenia can experience depression separately from their schizophrenia symptoms. But that's not schizoaffective disorder. Schizoaffective disorder is diagnosed when depression or mania are present for the majority of the time, when they also experience symptoms like hallucinations, delusions, and disordered thinking. Symptoms of depression include symptoms like prolonged sadness, having low energy or fatigue, feelings of hopelessness, helplessness, and/or worthlessness, thoughts or actions of self-harm. Mania is characterized by symptoms like racing or intrusive thoughts, grandiose beliefs, sleeplessness, risky behaviors. Chart: schizophrenia versus schizoaffective disorder. Condition: critical symptoms, depression symptoms, mania symptoms. Schizophrenia: hallucinations, delusions, and/or disordered speech. No. Depressive type schizoaffective disorder: hallucinations, delusions, and/or disordered speech. Yes. No. Bipolar type schizoaffective disorder: hallucinations, delusions, and/or disordered speech. Maybe. Yes. Challenges with diagnosis. Schizophrenia affects about 22 in every 1,000 people. Schizoaffective disorder is estimated to affect about 3 in every 1,000 people. But that estimate is harder to know for sure because diagnosing the disorder can be so challenging. It can be tricky to do the longitudinal work necessary to get the diagnosis right, particularly with schizoaffective disorder. You really need to have a good picture of the patient, Dr. Crew explains. There can be a haste to diagnose a person who has mood symptoms with schizoaffective disorder. Or, on the other hand, you can easily miss symptoms that would have led you to that diagnosis. Consider a person who arrives at the emergency room believing the CIA is watching them but doesn't have proof. They also hear voices that no one else hears. Those can be clear indications of schizophrenia. So, that's the diagnosis they're given. It may take a much deeper conversation to recognize that person also has a hard time getting out of bed most days, depression. Or that they recently stayed up for a few days straight repainting their entire house, mania. Treating schizophrenia and schizoaffective disorder. Early and continuous treatment for schizophrenia and schizoaffective disorder is critical. The conditions can severely impact your physical, mental, and social well-being if they aren't properly treated. A combination of therapy and medication is typical for people with schizophrenia or schizoaffective disorder. Antipsychotic medication can help improve symptoms of schizophrenia. People with schizoaffective disorder will typically also take antidepressant medication or mood-stabilizing medication to even out the extreme highs and lows of depression and mania. It's critical that people with schizophrenia or schizoaffective disorder take their medication as directed and seek regular follow-up care to manage their condition. But some people with these conditions may have trouble adhering to a medication schedule. For some people, long-acting medication, like a shot you only get once every few weeks, can help, Dr. Crew says. Seeking help. It's a catch-22 that can be difficult to overcome. People with schizophrenia or schizoaffective disorder need medical treatment. But the conditions themselves can make people resistant to even considering that they have a condition. So, they often don't seek treatment. Hallucinations feel real. Delusions are incredibly hard to shake. And mania can make people feel incredibly happy, even euphoric, not a symptom people typically seek treatment for. For most people, treatment is initiated by some outside party like family or law enforcement, Dr. Crew notes. The patient themselves may not recognize that they're experiencing any symptoms. Do reading, puzzles, and similar activities really stave off dementia? Use it or lose it is a common adage increasingly used for matters related to brain health. But to what degree does using cognitive faculties prevent them from deteriorating? Medical News Today looked at some of the latest research and spoke with experts in the field to find out. Can reading and similar activities help stave off dementia? Image credit, Simone Wave/Stocksy. Millions of people around the world live with dementia, a chronic neurodegenerative condition that affects memory and thinking abilities. The most common form of dementia is Alzheimer's disease. While some treatments do exist to help manage the symptoms of dementia, there is currently no cure for the condition. While research is underway to understand more about dementia pathology and to develop treatments, significant amounts of research are also underway to investigate how lifestyle interventions may affect dementia risk and cognition. Some of this research is investigating how cognitively stimulating activities, such as reading and crossword puzzles, affect dementia risk and cognition. A study published in Neurology in 2021 found that high levels of cognitive activity, such as reading, playing games like checkers and puzzles, and writing letters, can delay the onset of Alzheimer's disease by 5 years among those aged 80 years and over. Another study, published in 2022 in PNAS, found that more time spent in cognitively passive activities, such as watching TV, is linked to increased dementia risk, whereas more time spent in cognitively active tasks, such as using a computer, is linked to a reduced risk of dementia. And a study from JAMA Open Trusted Source, published in July 2023, found that frequently engaging in brain-challenging activities, including journaling, playing chess, and solving crossword puzzles was associated with a lower risk of developing dementia among older adults. To understand more about these associations, Medical News Today spoke with 5 experts on topics including how cognitively stimulating activities reduce dementia risk, what else reduces dementia risk, and how to take action on the research. Engaging activities boost cognitive reserve. To begin, MNT spoke with Dr. Joyce Gomez-Osman, Vice President of Interventional Therapy at Linus Health, and a voluntary assistant professor of neurology at the University of Miami Miller School of Medicine. She said that cognitively stimulating activities such as reading and crossword puzzles reduce dementia risk and boost cognition by increasing the cognitive reserve. Trusted source, which she likened to the size of one's mental library. Each thing we learn and know is like a book on a shelf. As new books are added, the library grows bigger and bigger. But why does this matter, you might ask? Well, building a library of information in your brain creates a buffer for memory loss, she said. When your library is extensive, even if many books are checked out, there will still be plenty of other books on the shelves, serving as alternatives and keeping the library functioning well, she added. She explained that cognitive reserve is developed over the lifespan through education and life experiences, especially those that are challenging and make one think. In a recent study, published in 2022 in Neurology Trusted Source, researchers investigated how childhood cognitive skills, education attainment, and leisure activities affected cognitive reserve. They followed 1,184 people from the United Kingdom from childhood until the age of 69 years, at which point the participants undertook a cognitive test with a maximum score of 100. In the end, the researchers found that people with a bachelor's degree or higher tended to score an average of 1.22 more points than those with no formal education. Those who engaged in 6 or more leisure activities, such as education classes, volunteer work, and social activities, scored an average of 1.53 extra points compared to those involved in only 4 such activities. Meanwhile, those who had a professional or intermediate level job scored 1.5 points or more on average than those with partly skilled or unskilled jobs. They additionally found people with a higher reading ability experienced slower cognitive decline than those with a lower reading ability. Much like our physical bodies can get out of shape and underperform, our brains can also become deconditioned, Dr. Robert Wiggins, a neurologist with Novant Health in Charlotte, North Carolina, told MNT. Safely challenging our cognitive abilities, as long as it doesn't lead to frustration, is healthy and will even improve our confidence and sense of independence. Though a 70-year-old may not have the cognition they had at age 20, challenging the mind could help them feel more like they did at age 50. Dr. Robert Wiggins. Mental exercises engage multiple parts of the brain. MNT also spoke with Dr. David Hunter, assistant professor of neurology with McGovern Medical School at UT Health Houston. He noted that research indicates that even patients with advanced dementia can benefit from what he calls mental exercise, anything that engages multiple parts of the brain at once. Reading, puzzles, art, conversation, games, and work are just a few examples. Really, the only rule is that sitting around watching TV doesn't count, he said. He added that coloring books, music, word searches, and simple conversation are also possibilities if patients can no longer participate in their former hobbies. Are there limits to the cognitive reserve? While experts agree that a person's cognitive reserve is important in helping them preserve their thinking skills, they also point out that there are limits to how much we can boost this reserve through mental exercises. Raphael Wald, a doctor of psychology and board-certified neuropsychologist at Baptist Health Marcus Neuroscience Institute, told MNT. People with high IQs tend to do better with dementia because there is more cognitive reserve. However, once dementia sets in, one cannot overcome the degenerative process by doing cognitive tasks like crossword puzzles. It may slow the process down somewhat though. MNT also spoke with Dr. Karen D. Lincoln, a professor in the Department of Environmental and Occupational Health at the University of California, Irvine. She noted that while some evidence suggests that cognitive exercises like crossword puzzles or word games slow cognitive decline in those with mild cognitive impairment, the evidence is inconclusive. These types of activities are important for stimulating the brain, but puzzles alone do not necessarily improve cognitive abilities or lower dementia risk. We have to consider our entire vascular system as a whole rather than separating them into individual parts, she noted. Dr. Gomez-Osman agreed that relying on intellectually stimulating activities alone is insufficient for reducing dementia risk. She noted that the field's most cutting-edge research shows that the greatest improvements in thinking abilities and dementia risk reduction occur when multiple healthy behaviors are targeted. What are the 12 modifiable risk factors for dementia? To share which behaviors to target, Dr. Gomez-Osman referenced the 2020 report Trusted Source on Dementia Prevention, Intervention, and Care from the Lancet Commission. The report highlighted 12 modifiable risk factors that account for 40% of dementia. A person's level of education, their level of social contact, hearing impairment, exercise routine, depression symptoms, alcohol use, midlife obesity, exposure to air pollution, smoking habits, head injuries, hypertension, high blood pressure, diabetes. The researchers behind the report noted that acting on these factors can reduce dementia risk by reducing neuropathological damage such as the buildup of tau protein and inflammation, increasing and maintaining cognitive reserve, or both. Just to give a sense, if we all took these actions today, we would slash over a third of dementia cases next year, said Dr. Gomez-Osman. How to take action to reduce dementia risk. It is important to emphasize that even if you are already experiencing memory loss, learning something new can improve your brain health. Challenging your mind by learning something new will boost your memory, attention, and thinking abilities and improve your quality of life, said Dr. Gomez-Osman. She added that creating new